Hello, everyone. My name is Robert Johnson, student of Nightingale College. Today I'm going to be doing a video skill of a intradermal injection. I'm wearing my ID badge. I'm wearing my school scrubs, uniform name, and including the shoes. Um, let's see here. First things first, let me just point out some of the things I do have here. I do have my gloves, my syringe, my tuberculin syringe. I do have the alcohol wipes, and I also have a gauze, right? So for this video skill, the order says that I am to give 0.1 milliliter intradermal injection of tuberculin purified protein derivative. What I have on hand in this medication bottle is going to be 5 tuberculin units per 0.1 ml, right? That is what I have in this here. So first things first, I am going to go ahead and check the doctor's orders against the electronic health records, right? So I'm checking that, and what I'm comparing is I'm comparing the 6 rights. That's going to be the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. Those are the 6 rights. From there, I will go ahead and check the medication check the electronic health records to the MAR. I'm also checking the 6 rights against those as well. So I checked those are good. So I'm going to be checking this at least 3 times, the 6 rights, making sure everything's consistent, right? So we can count that as number 1. So first thing I'm going to do now that I'm done checking that, I'm going to make sure that I provide hand hygiene, and I'll gather my medication and supplies. Right, medication out the drawer, and I already checked those 6 rights. And I got my gloves, as I said, the syringe, the medication, the alcohol wipes, and the gauze. I'm going to go into the patient's room, place those down on a dry surface, and I'm going to introduce myself to the patient, let him know why I'm here. Hello, Mr. Jones. My name is Robert. I'm a student of Nightingale College. I'm here because your doctor would like you to have a tuberculosis skin test, and the way that's done is we will be giving you an injection of tuberculin medication. It's going to be a skin test an injection right up under the epidermis. It's going to be right there in the skin. It's going to be leaving a little bubble there. But before we begin, I'm going to go ahead and wash my hands and provide you some privacy, okay? So I'll put the privacy curtain for the patient. I'll go and wash my hands. And then from there, now that my hands are clean, washed, of course I still have hand sanitizer here too. I will go ahead and check, do a 2-point verification of the patient's ID band. I'm going to have the patient verify verbally as I'm confirming the information on the ID band. So, Mr. Jones, can I please see your wristband? Mr. Jones is going to give me his wristband. Mr. Jones, can you please tell me your name and your birthday? Right? So he'll say, Tim Jones, 1955 is your birthday. Thank you very much. That looks good. As I said, Mr. Jones, I'm going to be administering 0.1 mLs of tuberculin medication for the skin test. It's going to go right up under your skin there, leaving a little bubble. Before we begin, Mr. Jones, do you have any type of allergies, seasonal allergies? Do you have any type of allergies to any medications or any foods? Mr. Jones confirmed that he has no allergies at all. Now that I'm confirmed Mr. Jones' ID, just FYI, I'm going to go ahead and do that second check. I'm going to compare the information from the ID to the medication MAR, to the MAR, making sure that looks good. I'm checking the 6 rights, right? Everything is confirmed there. And then from there, I'll go ahead and explain the medication to Mr. Jones. As I said, Mr. Jones is going to be the purpose of this injection is going to be a tuberculin skin test to rule out if you have tuberculosis or not, right? One of the side effects of this medication, the use of this medication, the actual actions of this medication, it is used to detecting tuberculosis, as I stated. And I will also explain to Mr. Jones the actions of this medication. And the way that this works is that we will inject a small amount of the medication right up under the epidermis layer of the skin, forming a little blister right there under the skin. I would inform Mr. Jones that we would recheck it again in 72 hours. I would also inform Mr. Jones of the common side effects, which was There may be some itching or some swelling. It may even resemble a insect bite right up under the skin. It may feel that way. From there, I'm going to also instruct Mr. Jones that although the skin may feel irritated or itchy, please do not scratch the area. I'm going to ask Mr. Jones to avoid the area. In fact, not to even rub on it. Don't press on it or anything like that, because we want that bubble to be intact. That medication needs to do what it needs to do up under that skin for 72 hours. Also, I will go over adverse reactions of this medication, Mr. Jones. It could cause fever. It could also cause a rash. The rash necessarily doesn't have to be in that area. It could be on different parts of your body. If you feel any type of tingling or any type of itchiness all over your face, that could be an allergic reaction. Please let us know. Or if you feel any itching on any parts of your body, please let us know, right? Then from there, I would also inform Mr. Jones. So upon receiving this medication, you may feel like that injection may feel like a little insect bite. I will let him know on that. And Mr. Jones, do you have any questions about the medication? No? Okay. Mr. Jones confirmed he had no allergies to any type of drugs or any type of seasonal allergies or medication. So we're going to go ahead and move forward. So first things first, I am going to select the site that I'm going to be giving this injection, right? I'm sorry, let me put on my gloves first. Gloves on first. And what we're going to do is I'm going to wipe off the cap of the bottle with the alcohol wipe and let that air dry. Okay, let's get rid of that one there. And I'm going to, with the syringe, with the cap still on of the syringe, I'm going to draw up 0.1 mLs of air into the syringe, just 0.1 mLs of air, right? Got that there, that's 0.1 mLs of air. With that, I'm going to remove the cap from the syringe, and I'm going to inject that air right into the tuberculin bottle, medication bottle, right? And now from there, I'm going to lift the bottle and invert it. And the same amount of air that I inject into the bottle, that is the same amount of medication I'm going to pull out, which is 0.1 of medication. And I'm going to tap it to ensure that there's no air bubbles. On this time around, there's no air bubbles on this one, so I'm going to remove this. And I'm going to show the camera there. There's no air bubbles there. And because I still need to prep the patient for this procedure, I'm going to do a one-hand scoop to recap this syringe, right? One-hand scoop. I'm going to put that back on. Now, as I said, I'm going to prep the patient. So what I need to do is find the proper site, right? And this is going to be 3 fingers below the wrist and 4 fingers above the intercubital space of the forearm. It's going to be right in this area here. First thing I'm going to do is inspect the area. And I'm looking for any type of skin irritation, any type of discoloration, right? Then from there, I'm going to, or any redness. Then I'm going to palpate, feel around, making sure there's no tenderness at that site, right? Everything looks good there. Then with my other alcohol wipe, I'm going to wipe the site, but from the center and circular motions from 2 to 5 inches outward, right? We're going to go circular, outward, okay? Want to let that air dry. Let's get rid of that there. So while that's air drying, I am going to go ahead and with the medication again, I'm going to do the third check to verify, checking the medication against the MAR, right? And on this third check, I'm checking the 6 rights. Everything looks good on the 6 rights. Now I can go ahead and work on administering the medication. So what I'm going to do is this. With these 2 fingers, with my thumb and with my forefinger, I'm going to hold the syringe this way, making sure that the bevel is always up. And I'm going to remove the cap. This is all done with my dominant hand. With my non-dominant hand, I'm going to use my thumb. I'm going to pull the skin tightly, right? I'm going to pull it tightly. And I'm going to, at 5 to 15 degree angle, I'm going to come in close to the skin, 5 to 15 degree angle, and then I'm going to insert the needle into the skin at 5 to 15 degree angle. And right up under the skin, once I see that bulge of the needle, I'm going to slowly inject the medication into the skin. Mr. Jones, as I said, like I said, feel like a little insect bite, but hang in there, you're doing good. And I'm going to remove the needle, right? The medication's in there. I'm going to remove the needle slowly, And once I remove that needle, I'm going to softly place the gauze right on top of that spot there. I'm not going to rub it or anything like that. Put the needle into the sharps container. And then from there, I'm going to just verify that there's no bleeding. There's no bleeding there, so I can remove that gauze. We don't want to use tape or Band-Aid because sometimes, or tape, yeah, because sometimes that the tape can cause irritation to the skin, cause the skin to be itchy. From there, I'm going to clean up my area, right? And give the patient a call light. Call light's there. I'm going to remind the patient, please, if you have any side effects, any itching, any problems, please let us know. That way we can document and communicate with your doctor. I'm going to perform hand hygiene. And I will go and document everything that I just did in this procedure. All right. Thank you very much.